Today we got Dr. Mehmet Tosun. He's a professor in the Department of Economics at UNR. He's also a Barbara Smith Campbell Distinguished Professor at UNR. That has to do with taxation. He's done a lot of work in taxation. Mehmet is also a research fellow at the Institute of Labor Economics. He's done a lot of work. He spent 8 years as a department head, kind of like I did that for 4 years, drudgery in the Department of Economics. And before coming here to UNR, he worked with the Bureau of Business and Economic Research at the West Virginia, which is one of the more distinguished Bureau of Business and Economic Research. So he knows how to take economic data and complex data and bring it down to people who can understand it, which is very important. Today, we're going to discuss a research project he's been doing with a grad student that he just completed, and that we're moderating and we'll make it into a University Center publication for everybody to make distribution. His topic is going to be community resilience, sales tax collection, and good old PILT. A lot of us are hearing resilience. Everybody's kind of like beauty. You know it when you see it. What is resilience? We're going to talk a little bit about it and how the Bureau of Census is doing it. So when we know the Western Nevada Development Authority and a lot of us who get funding from EDA during this CARES Act and during this pandemic, there's a lot of questions of how to make resilient programs and all this. And so I thought I might have Mehmet talk a little bit about the resiliency and what they've been doing and some good information that can be used by the public when you make your resilient strategic plans, which are going to be more and more. So Mehmet, please take over, and I'll be here. I'll put myself on mute, and so please go ahead.
Okay, thank you, Tom, for that introduction. I'm gonna go ahead and start sharing this. Okay, let me put this on the full screen mode. All right.
Got it, Mehmet.
Yeah, can you see everything okay?
I see everything. It's going good.
All right. Okay, great. Thanks, thanks, Tom, again. And it's a pleasure to be here, and it's great to see a number of people like on the Zoom today. Yeah, I should start by saying that, well, I have few things happening in this presentation. So I have, as Tom said, this sort of a big portion on the census community resilience estimates, which is something new, and I will say a few things about it. And of course, I have my student here with me, Ethan Olasinski. And I should say that, well, a former student, because Ethan actually graduated back in December. So he's no longer an undergraduate student, at least. Well, Ethan, of course, knows quite a bit about the data, and in some ways, like, he may actually know better certain things about the methodology as well. So I will basically turn it to him if there's especially a question about the specifically about the data or the methods used. Although, as we were talking with Ethan, some of the methods that the census people use for this is still a little bit cryptic. So we're not going to say that we understand everything that they have done, but I think the variables, as I'll show you in a few minutes, they will make sense to you. But then in separate projects, I'm looking at the relationship between resilience and sales tax collections. As Tom said, I have a great interest in taxation research. We're looking at another actually set of census products because census started collecting and then releasing data since the pandemic started on monthly sales tax collections, which they never did before. And this is for all states, not just like in a few states. And finally, I'm going to say a few things, if there's any time left, about the PILT, the payment in lieu of taxes, which of course is a big issue for our state and for a number of states. I think about 1,900 counties around the U.S. that receive PILT payments. Right. So let me go ahead and start with the resilience. So what is community resilience? So first of all, again, this first part is mainly the research that we have done with Ethan, and that actually led to a policy brief that we called Nevada's Community Resilience to External Shocks. And so I'm going to present a lot of our findings from that, and then move on to the other ones. But let's start with the definition. So according to the National Institute of Standards and Technology in the Department of Commerce, community resilience is defined as the ability to prepare for anticipated hazards, adapt to changing conditions, and withstand and recover rapidly from disruptions. So recovering from, variety of hazards and disruptions in our lives. Well, of course, like COVID-19, definitely presents those challenges, those disruptions. So this, I think, Tom and a lot of you are the experts on community resilience. I'm really not, but I'm definitely seeing a big interest in this topic during the pandemic, right? Because it is hitting the communities really badly, and the response to the pandemic, and then the recovery from that, and the pandemic is still going on, but recovery, is going to be a big issue. So the resilience of the communities is a big issue. So and we immediately realized, as we were looking at the some of the data, is that it is really important to look at resilience at the local level. So you can, of course, look at state or even national level, how resilient United States is to these shocks as the community, right, or the state level. But we realize that it is really important to look at the this at the sub-state, and preferably county level. And the good news is that Census is actually providing data at the county level and even at the census tract level, which is below the county level, that correlates with the zip codes. So, for instance, Nevada has the 30th highest number of COVID-19 deaths out of 50 states, right? So that doesn't sound too bad, I guess, relatively speaking. But then if you look at, for instance, Clark County, it has the 11th highest number of COVID-19 deaths out of more than 3,000 counties, right? So that's definitely eye-opening there. So Census Bureau and the census estimate. So this was initially released on June 22nd, 2020. So I'm actually putting the exact dates. I'll do the same thing with the sales tax numbers. You see that this was in the summer, right after the pandemic started in spring, right? And they put this as part of their experimental data products. That's actually the term they use for this. So we're not making this up. So they call these things experimental data products, which tells me that, well, we're going to do this, given the circumstances with the COVID, and who knows, maybe they're not going to continue doing this in the future. I really hope that they will. But again, the term experimental kind of makes us a little suspicious. So they're using data from the 2018 American Community Survey, and they use the data from their own population estimates, and also data from the National Center for Health Statistics, which has this National Health Interview Survey. So in a way, they're merging or combining data from different sources, and they have their own resilience definition. So I have that here as well. So it is defined as the capacity of individuals and households to absorb, endure, and recover from the health, social, and economic impacts of disaster, such as hurricane or pandemic. So they added the pandemic, I guess, to the definition, which of course makes us think that, well, this is a fairly recent definition by the US Census Bureau, which of course makes sense. Another thing that you realize is that, well, yeah, it is the community resilience, but it is really related to individuals' households, right? So you see that is mentioned specifically in the definition, which is a little bit different than the one before. Okay, so what are they using as factors? So they're using 11 risk factors. So these are related to demography, such as 65 and older population, some health, of course, factors in there, such as specific ailments that you have, when the household or the individual asks these questions, such as diabetes and so on. And there are, of course, income related and other economic and living conditions related, factors or variables in their calculation. So, and of course, like, no doubt, they have the pandemic in their mind, right? So these are all very important factors, during the COVID-19 pandemic. So, these make sense. So, according to the census, communities with 30% or higher share of population with 3+ risk factors are considered high risk. So, because we don't know what that threshold is. So the Census Bureau, this is again coming from the census. We are not putting this 30% threshold there. So they're looking at if it is 30% or higher for the 3+ risk factors, which they call the high risk factors. They call those communities high risk communities, or like, of course, low resilient, communities with low resilience. So the rural communities are particularly high risk, as their data shows, like 30% of rural counties have that aspect of 3+ risk factors, for the 30% or more of their populations, as opposed to 14% for urban counties. So there's a big difference between rural and urban. So the rural communities are particularly at high risk in terms of resiliency. Okay, so in case you want to know specifically those 11 risk factors, here are those. As you see, a lot of them are like from the ACS. Like that includes variables about the income, variables about the single, like households, crowding in the household, communications barrier, and unemployment, and health insurance coverage, and so on, and disability, of course. But then you have demographic variables such as age 65 and older, and then health factors such as heart conditions, diabetes, and asthma or emphysema. So when you kind of like look at the census data and kind of break it down by different regions. So as you know, the U.S. Census has their own region definition. So according to the census, we have 4 regions, and they're listed as Northeast, Midwest, South, and West. So you see South region has by far more high-risk counties. So 478 out of 1422, which is like close to 34% of the counties in the South are considered high-risk, communities. In the West, of course, which we belong, it is less than half of that, only 66 out of 448, and close to about 15%. But as you see, it is still a lot higher than what we see in Northeast and Midwest. So South and West seem to be faring much like worse compared to the Northeast and Midwest regions. And similarly, if you think about like what is the average share of the population in the counties with high risk, you see a similar pattern, although the difference between West and the Northeast and Midwest is much less. But South, again, has the highest average share of 28.2%, where it is like about 25 for West, and 24 for Northeast, and close to 24 for also Midwest. So South seems to be carrying more high risk communities than pretty much every other region. Okay, so now, of course, let's go specifically to our region, and then to our state. So the Western states, as you see for Nevada, so we have 3 categories here. So 0 risk factor means like the lowest risk, right? So like that, or the highest resilience for the community. 1 to 2 risk factors is considered medium, and then 3 or more is considered high risk. So if you look at the high risk, like the last column there, you see that Nevada, like compared to other states, not doing really good. So they're actually we are leading pretty much all other states. So I see that the only other state that has higher than 30% average is actually New Mexico, right? So and we actually have the highest, and significantly above the average, for the Western region, right? So so this is of course done at the state level. In terms of the very low risk or high, like resilience, kind of a similar story. So Nevada has maybe not the lowest number, so that actually belongs to California, interestingly, but it has one of the lowest, average percentage for the low risk communities. So again, this shows that Nevada seems to be doing much worse than our comparable states, which are Western states. So like within Nevada, so in terms of Nevada counties, so again, I have the same three categories: 0 risk factor, 1 to 2, and then 3 or more. So if you look at the 3 or more, because that's again the high risk, Esmeralda County is leading the group with like close to 36% of their populations having high risk, like followed by Clark, Mineral, and Nye. So you see that if you go with that 30% threshold for the census, we see 4 of our counties, Esmeralda, Clark, Mineral, and Nye, exceeding that 30% threshold, right? So maybe surprising, maybe not. So Clark County is right there at the top, right? Now, where is Washoe County, our county here? That's somewhere in the middle. And if you are wondering about like the most resilient or like the lowest risk, that's the first column here. So that's Churchill County, and Alco seems to be doing much better, right? So they have the highest percentage, like greater than 30%, with low risk population. And you see that those two counties are at the bottom in the last column here too. In terms of zip codes, so the interesting finding, no, they're not interesting in this one. It will be interesting in the next one. So the Clark County, not surprisingly here, is because there are so many census tracts, we only looked at the top 10 census tracts, and you see Clark County dominates in this group, right? So the only other thing you see here is Washoe County with the zip code 89502. I'm not 100% sure like which exact location these zip codes correspond to, but I think for the Washoe County, that's probably very close to the airport, like Reno Airport, but I may be wrong. And it could be to the east, like eastern part of the city as opposed to west. So with the medium resilience, so we have Washoe and Clark again, in the top 10. So these are, of course, not the high risk communities, but they're somewhere in the middle, right? Now, how about the highest resilient? Interestingly, this is the interesting part. Interestingly, you see Clark County again at the top. So the Clark County, some Clark County communities have the highest risk populations in the state, but they also have, the county has communities that have the lowest risk populations at the same time. So that actually tells us kind of big disparity within the county, in terms of resilience, right? So that's another interesting thing to see here. And Alco, again, you see Alco here. So Alco was leading in terms of the resilience, like in the previous slides. So you see the Alco, census tracts also at the top, together with Clark, and then there are 2 Washoe, zip codes in there as well. Okay, so kind of showing the same thing using the maps, because visualization is always nice, right? So these are showing the census tracts. So in terms of I'm just going to point to the one at the right here. In terms of the highest risk, you see it is Washoe County is not really high up there, although you see, maybe you don't see it very well. It is probably not very clear, but because they're really small, locations. Some dark colors also in the north, but it is the darkest colors is in the south. So you see at the tip of the Clark County right here, right? So I believe there are some of those communities in Henderson and Summerlin area in near Las Vegas. And you see with the lowest resilience, the far left, like some darker colors again in the eastern part of the state, and like a little bit lighter colors in the south, right? But it is kind of mixed with the census tracts. Okay, now, so that was again like the first part of the presentation where I'm just like talking about, here's what the census resilience estimates are showing. But at some point, of course, like we need to look at the relationships between resilience and some important variables. And of course, for me, because I have interest in taxation, I decided to look at the tax revenue aspect of this. And this is a new project with two other students, Scott Cunningham and Jalen Hendricks. They're not, here in the podcast, but they've been helping me with this, and really interesting work here as well. And off the bat, of course, like you can imagine that resilience will have something to do with the tax revenue generation. So if these communities that are not resilient, like high risk populations, subject to fluctuations in their economies, right? So the tax revenue, it starts with the people and it goes to the economy, and then you basically get the tax revenue, right? So your base for taxation is the people and the economy, right? So the resilience will definitely have something to do with the tax revenue generation as well, right? So, and why is revenue generation important? Well, because revenue will impact the public service delivery. So they're all connected with each other, right? So like revenues to expenditures. So the US Census Bureau, as I said before, also had some experimental products related to retail sales and then sales tax collection. So we are using in this one the monthly state sales tax collections by the Census Bureau, which was again the initial release. If you look at the date, October 27, 2020. So, like in the fall and during the, of course, like the pandemic. And it was the time when, of course, like the new wave was already, I guess, like, happening, right? So unfortunately, this is only provided at the state level. So we have no way to do this at the county, level, unfortunately. But at least like we have monthly data, which of course, brings a little bit more detail to the analysis. And you can track things from March 2019 all the way to December 2020, right? So it starts with the period before the pandemic started, and it has the months after the pandemic started. So you can actually compare, like what has been the change from March 2019 to March 2020, and then April 2019 to April 2020. So that's what we're doing. So the changes, from the time before the pandemic to after the pandemic. So we think that will capture the impact of the pandemic as well. So some scatter plots. This is not a very highly negative correlation, but it is still a negative correlation. So when we look at the average change in sales tax collections, between the 2019, 2020, so average across all months, and then compare it to average share of high risk population, so the 3+ risk factors, what is the average share of those, places with the high risk population. So again, this is done at the state level. So these are all the 50 states, and I'm, because it is pretty crowded, I'm only pointing out Nevada here. So you actually get a negative correlation. So the places that have high risk tended to have lower sales tax collections, like change in sales tax collections from before the pandemic to after the pandemic. And Nevada has, relatively high, average of high risk population. And you see that we had roughly about, so these are not in percentages, the ones on the vertical axis. So it will translate into 11% decrease on average in the sales tax collections, monthly sales tax collections, which is, as you see, one of the highest out here, right? There are some states that beat us, like, Hawaii, I think is one. I believe New York and Massachusetts, so like those states that were hit by the pandemic really badly early on, they have recovered since then to some extent, but the averages are pretty low. Now, if we do the opposite, so how about resilient communities and the change in sales taxes? Now you actually see a little bit stronger correlation of 0.27, positive 0.27, so positive relationship. So again, you see like Nevada, here as well. So we have, less, of course, of the low risk population. It's nice to see this positive relationship. So these communities with like a higher resilience and lower risk population tended to do better in terms of the sales tax collections. All right, and we've done some basic regressions. I don't want to bore you with a lot of numbers here, but I'm just going to point out a few things. So you see some negative and significant coefficients, that basically goes in line with the scatter plots that I showed you, right? So the higher the average high risk population, lower the change in the sales tax, right? And when you do it actually with the maximum high risk population in your state, right, which indicates that, well, you have some communities that have like extremely high risk, you see it is actually a little bit higher or more consistently significant, like with those two variables here, negative and significant signs here. And then if you look at the variations in the high risk population in your state, which points to the disparities or like the variation, right? Or the regional inequalities in a way. You also see, although it is not consistently significant, but you also see a negative and significant signs here, which means that the places that have the bigger disparities have done worse in terms of sales tax collections. Okay, Tom, do I have time to say a few things about the PILT?
Yes, you do.
Okay, perfect. So, so I'm sure a lot of you already know about the PILT, but our the people that will listen to the recording later may not know. So let's start with the PILT definition. So what is a PILT? So this is coming from the DOI, right? So Department of Interior, provides the definition for us, and it's providing the data. So federal payments to local governments that help offset the losses in property taxes due to non-taxable federal lands within their boundaries. So if it is federal land, you cannot impose the property tax, right? So it's simple as that. So the payment in lieu of taxes, come in to help those communities that especially have a lot of like federally owned land, right? So this was a program that was started in 1976 with discretionary funding that was subject to annual appropriation process in the Congress. But then it was turned to full funding briefly. We're still not going to say that it has full long-term funding, but it's gotten better, right? But maybe you think that that's not true, like it's gotten worse. So I'm open to, of course, like your comments on this. Important thing here is that it pays for important government services such as firefighting, police, public schools, road construction, search and rescue operations, and so on. And some of these will be related to community resilience. So that's why we were wondering, like, what is the relationship between resilience and the PILT? So of course, some issues with the PILT, especially for Nevada, and of course, like some other states like Nevada, as I said, we cannot collect the property tax, and we own a lot of federally owned land, right? About 80% of our land is federally owned, and that will be subject to PILT. So the PILT payments will be really important for us. And as I said, there's really no long-term full funding of this program still, so that's a concern. And Nevada, as I'll show you in a minute, receives much less relative to the land it owns, and the real value of the payments remained either stagnant or even declined when you consider the inflation that happened over the years. So our question is, what is the relationship between PILT and resilience? So this map shows where we are. So we have in fiscal year 2020, we had close to $28 million in PILT payments for our more than 56 million acres that were subject to the PILT payments. That gave us 49 cents per acre, which is the second lowest after Alaska. Well, Alaska, obviously, as you can see in the map, it's a big landmass, so that's it's kind of hard to like compete for the bottom, I should say, like with Alaska. So you see that there are 5 states that have less than $1 per acre, and we are one of them. And we are, as you see, the lightly colored states, like Nevada is one. Of course, like you see Oregon, and then some other states. I know one state is not getting any PILT payments, or like getting almost zero. I always confuse whether it is Delaware or Rhode Island, one of those 2 really small states. But yeah, so the point here is that Nevada seems to be getting much, much less per acre than almost any other state in the US. In terms of changes over time, so like looking at the data from the UI, from 99 till 2020, so the black line is just like showing the Nevada PILT payments, the one that is not adjusted for inflation. You see a rising trend. So this jump in 2008 is because of the change in the law, right? From discretionary to more like a full funding, but it wasn't still full funding afterwards. And when we look at the adjustment for inflation, the red line, you see that since that time, since 2008, there was actually some decrease at first, and then it is like pretty much flat, right? So like no increase, and there was like a period of a decline. So if you do per capita basis, so again you see a similar pattern, some periods of decline, but fairly flat compared to the one that is not adjusted for inflation. So that's of course a concern for us. Okay, relationship between the PILT payments and the resilience. So the same resilience data from the census plotted against the PILT payments here. And I actually excluded Clark and Nye counties because they were outliers. So maybe because of the special circumstance of Clark County having a lot of population due to Las Vegas, they received like definitely a lot more PILT payments. But if you exclude Clark and Nye, you actually see a fairly high negative correlation between the PILT payments and the high risk. So the places, the counties that have a higher high risk population actually, get less PILT payments, which is a concern. So if you are, as the federal government, if you are trying to help the communities with high risk or low resilience, there should be more PILT payments, not less. So we are actually seeing just the opposite. We see a negative correlation between the PILT payments and the high risk population in Nevada counties, except for Clark and Nye. Okay, so that's all I have. Tom.
Excuse me. Thank you, Mehmet. What we want to do is, because looks like some federal funding is going to be with CARES on resiliency. And I think this census is the only thing that gives a national values to resiliency. That's why I wanted Mehmet to go over it and kind of understand it, what people are saying, and maybe how we can incorporate it. I think it's kind of interesting, Mehmet, and even our sales tax revenues, even with the federal stimulus, there was that federal stimulus to unemployment wasn't enough to raise those that much, right?
Right.
I would say. Okay.
Yeah.
And I guess it's no surprise why Clark County, because the portfolio of Clark County is gaming industry, and that face-to-face really brought it down to be severely impacted. For I was going to open. Anybody else have any questions? I appreciate it. If you have a question or two, I'm open for anybody to participate here.
Tom, there's a question from Richard. How do the resiliency factors relate to A, unemployment rates resulting from COVID-19, B, COVID infection rates, and or C, COVID-19 mortality rates?
Yes, thanks, Dick. Sorry for missing the question in the chat box. So that's a good question, but here's the problem. The resilience data that the census is releasing is from 2018. So remember that it is the 2018 American Community Survey. Yeah, so the ACS, American Community Survey 2018, and then the National Center for Health Statistics. So what Census Bureau did is that they use the variables or these risk factors that they think, and I will also think, correlate very well like with the problems related to COVID-19 pandemic. But the data that they had, that support that is, obviously the most recent data they had was 2018, because the data comes with a lag. So, the sales tax collections monthly level data, I'm really surprised that they're actually releasing it now, because that's of course like with a very small lag compared to others. But unfortunately, the resilience estimates, due to that lag, we do not have the revised version of these estimates from 2020, from the pandemic period. But if you look at, for instance, the unemployment rate that you mentioned, that's actually risk factor 5, no employed persons in the household. Right? So that was actually one of the questions asked as part of the ACS.
I think what will happen, Mehmet, once the DETR data called QCWS and CES come out, we can regress those and see. It'd be yes, that would be quite interesting how that is impacting the economy, and then I don't know how soon it's going to come out. Everything comes out a little slow with the feds, but
right.
That would give us the ability to then, in our strategic plans, to say, COVID really impacted us X amount. There's data coming out that has COVID impacts on occupations, but this, what he has there, change in sales tax. If we had change in unemployment rate, of course, the change in unemployment, you got to watch out because people come out of the labor force. We'd have to look at that, but also change in employment would be very interesting to see what are the significant factors.
Yeah. And I just wanted to point it back to these regression results. So one variable I didn't get a chance to talk about was the median household income. You see that is actually turning negative and significant. So even the places with relatively high median household income experienced a drop in the sales tax, collections, right? So you can actually, I bet that if you look at the unemployment rates, use this as a variable in your regressions, that is probably going to turn out negative and significant. So places with high unemployment rates definitely fared a lot worse. So, and despite the fact, as Tom said, that at least in the 2020 numbers here, you had the impact of the stimulus payments that should, go into, purchases of goods that are subject to the sales tax. But, apparently even that didn't help.
I think with the Fed has also showed that people put a lot of money in savings. So anyway,
yes.
Bob, you got any other questions or anybody else?
I don't.
Tom, maybe we can ask Ethan to show his table. This was literally done last night, because I asked him about what you told me regarding the development districts, and then he crunched the numbers for those. And I'll actually let him. So you already heard from me, so I'll let him kind of speak a little bit.
Okay.
Okay, let me stop the share.
All right. Okay.
And apparently Ethan is at school, so he's wearing a mask.
Yeah. So as was talked about, our resilience paper, first of all, I'd say it's a pleasure to be here. And thank you, Dr. Tosun, for inviting me to speak on the podcast. So as was just talked about, can everyone see the screen?
Yeah.
Okay. As we talked about, we looked at community resilience at the state level for Nevada, at the county level, and at the census tract level. But of particular interest to this presentation is to also look at Western Nevada Development District, Northern Nevada Regional Development Authority, and the Southwest Central Development Authority. So what we have here is actually kind of tells a very similar story with the North-South, and basically the results are strongly influenced by the counties that comprise each of these regions. So when we say which of the regions these development regions have 3 or more risk factors, the highest is 33.88%, almost 34% for the Southwest Central Development Authority. But a big part of that is that Esmeralda County, which we saw had one of the highest, is one of the counties that had one of the highest percentages of 3 or more risk factors. That's included in this development authority. So that explains a lot of that. And that's like markedly higher than the other 2 areas, having around 21% and then 26% about with 3 or more risk factors. So when we look at the 0 risk factors, the one that has the highest amount, which would be, as we've talked about, the most resilient, is the Northern Nevada Regional Development Authority. And this is also comes as no surprise because Elko County is included in that. And Elko County, we saw, also had some of the most resilient census tracts comprised in it. So this is just kind of a really quick, simple little breakdown. And since we just kind of threw this together, we haven't included the census tracts from Fernley yet into the Western Nevada Development District, but this just kind of gives a kind of a high level little overview of for comparative purposes of these different areas for Nevada.
So in a way, what we can do is look at this, and given if we were looking at resiliency from census data, we could take a look at what the average is for the U.S. and look at see how high or low these different districts are. And you could say you're a high, have high risk factors, and anyway, that could be added to anybody's strategic plan or funding, I think. Thank you.
Definitely, yeah.
Any other questions from anybody? The PILT payments are something that Ethan that we're working on. PILT payments are really unique. There's 2 branches. Many of our counties are hit with the population, and it's really some differences we need to explain. But well, I don't see any more questions. So Mehmet and Ethan, I do appreciate your time. I just wanted to show you this is something that just came out, especially when we talk about resiliency. It's been talked a lot about by people, and that how it can be used. When Ethan gets finished putting in Fernley, we'll have a more descriptive of the Western Nevada Development District. We can use it for whatever purposes, but it's the Bureau of Census that's using this, and they're going to go back and say, this is what the national value says your resiliency is and how we plan around it. So if no other questions, I appreciate everybody's time, and I hope if you have any other suggestions for programs you'd like to see us do, send us an email. Most of you know my email. So appreciate your time. We'll inform you when we have some others later. Thank you.